So hi everyone, thank you so much for being here today. My name is Jennifer Green and I'm a physician assistant in movement disorders. And today I'm going to talk to you about what Synapticure is, how we care for patients. Oops, see, I knew I was going to mess up the slide.
Can you use the arrows? Or...
I tried to use the arrows and that's what happened. So hold on just a moment. There we go. I think that's what I did wrong. Nope, no arrows. Okay. Sorry, technology problems. Where did my mouse go, Zach? How did you get the mouse to come back earlier?
Oh, I just went all the way to the left.
Oh, okay.
Yeah, it's weird because there's like this little blue thing that pops up. But
Okay.
yeah, your mouse should be on that screen.
The only problem is it's not letting me
Go to the next slide.
go through the note. Hold on. Is that changing that? Okay, we'll see how this works. Okay. Start over. Today I'm going to walk you through what Synapticure is, how we care for patients with Huntington's disease, and most importantly, how we try to make care easier and more accessible for you and your families. So at Synapticure, you're not just seeing one provider, you're seeing a team that specializes in neurodegenerative diseases, including Huntington's. Myself personally, I've been working in movement disorders for over 13 years, and all of our neurologists, Dr. Ferluga, Dr. Hatcher-Martin, and Dr. Tate are fellowship trained in movement disorders. So this isn't just another general neurology group. You're getting care from people who are very familiar with the challenges that Huntington's disease has. Okay, so I wanted to start here because for most people with Huntington's or family members that have Huntington's, this probably seems pretty familiar. The journey through the care system. Care can feel very fragmented. There are often multiple providers, long wait times, a lot of coordination that falls on patients and the families. Symptoms can start subtly, but diagnosis can take time. And over that time, things become more complex, not just medically, but emotionally and logistically as well. And for many families, the burden of coordinating the care and managing the appointments and keeping everything together falls on the caregiver. So one of the biggest barriers in Huntington's disease care is access. We touched on that earlier, but most movement disorder centers have a 9 to 12 month wait period just to get in as a new patient. Oftentimes, even with follow-ups, that doesn't change significantly. Follow-up appointments are usually 6 to 9 months apart. But with Synapticure, we can typically see new patients in less than 2 weeks. It's not just about getting in faster, obviously. It's also just about having that ongoing access, not just that first appointment and then you're left with no point of contact for all the questions you came up with after the appointment. We're able to see you, in the interim throughout. And you have a care team that you can reach out to between visits for medication questions, if there are symptom changes, and then helping you figure out next steps and navigate orders that were given at that first visit. Our mission at Synapticure is really centered around closing the gaps in care. That means improving access, connecting patients with expert providers, and making sure care doesn't stop after a single visit. We all focus on reaching patients wherever they are, including rural and underserved communities. So a lot of patients, it may be 4 or 5 hours to a neurologist, much less a movement disorder trained neurologist, but everyone deserves to have access to good care. And I think this is probably my favorite slide. So how Synapticure started. Synapticure was actually built from lived experience. One of our founders, Brian, was living with ALS, and he and his wife, Sandra, were trying to navigate the healthcare system. And they experienced firsthand how difficult it was having multiple providers, limited coordination, delays in care, and what they needed didn't really exist. So they built it. That patient and caregiver perspective really shaped what our approach is today. And I do encourage you to, for the full story, watch the documentary for Love and Life on Prime. It is very, very good. It's about an hour and some change, but it really, they portray the struggle for the patient and caregiver perspective, just trying to work through the process and, you know, deal with that day-to-day struggle for care. So Huntington's disease care isn't just one appointment, it's ongoing, and it involves multiple pieces. Medical care, behavioral health, family support, long-term planning, and without coordination, it quickly becomes very overwhelming with all the pieces you're trying to fit together. And that's where Synapticure comes along to try to simplify things. So this is where Synapticure fits in. We bring specialized care straight to you. That means no long travel time, no waiting in waiting rooms, no need to take an entire day off of work, just for a single appointment. And that's just for the caregiver. For the patient, they're oftentimes just absolutely exhausted, wiped out that day and the next day. And sometimes the next day, it becomes, one appointment becomes a 3-day issue. Care happens from the comfort of your home on your schedule. And that, you know, that's a relief moment for everyone. And we're able to provide care in all 50 states, and we're covered by most major insurance plans, including Medicare and Medicaid. So it's not just more convenient, it's more accessible. I think this is the big question. What happens? How does this work? So that's probably what we get the most questions, or at least the most kind of side eye about, you know, is this a real healthcare clinic? It is. It's very structured and straightforward. So initially you'll get a Zoom link and you'll join via the link, check in with the medical assistant, and the medical assistant's going to go over medications, any updates from the last visit, what your particular concerns are. They actually list out your biggest concerns. So that's the first thing as a provider that I see before I join the visit. I already know what's concerning for you, and I'm going to address that first. So you'll meet with the provider. We'll talk about symptoms, history, you know, previous diagnostic studies that you've had done, and your concerns and goals. And we'll do a complete neurological exam. So specifically for Huntington's disease, we use the Huntington's disease, the UHDRS rating scale, and it's the same as in clinic. It's the same, you know, finger movements, walking, looking at eye movements, looking for the extra abnormal movements, the chorea, seeing how someone is sitting, seeing if there's dystonia. It's all the same exam, just from the computer. For the upper body, we just have you set it on the table, or if you have a caregiver there, ask the caregiver to hold it. And then for the lower body, you just sit it on the floor and do the same thing. And for walking, same, you can sit it on a table. I can watch you walk back and forth a couple of times in your room, and I have your full exam, just like I was sitting in the room with you. Most importantly is the personalized care plan. We go over that with you, and then that is going to be readdressed whenever you get in touch with your care coordinator. So the care coordinator follows up with the patient just a few days later, just to go over everything again. I myself have done it even going to my kids' healthcare appointments. I sat in front of the provider and they told me all these things. I'm like, yeah, I got it. And then I leave and I'm like, what was I supposed to do? There was that thing they said to do. You're going to get a second, it's like a reminder session with the care coordinator. And then the care coordinator is just going to help keep everything kind of moving along. So one common question is how much of the exam can be done virtually, and we just kind of talked about that. I mean, most of it. You're going to get the same level of care you're going to get in person. Nothing's going to be left out. We assess, like I said, eye movement, speech, thinking, coordination. We can do cognitive assessments, movement patterns, including the chorea. I give a few simple instructions. I give you an example of what I'm looking for. So you're also getting a visual reminder, and then I watch you do it and grade it. And then if anything needs in-person follow-up, say something outside of the norm comes up on exam, we're going to make sure that we coordinate with someone locally to get you care there. But what really makes the difference in this model is what happens after the visit. Care doesn't stop there. So we focus on ongoing support because Huntington's disease changes over time and your care needs to evolve with that. So the thing I keep talking about, your care coordinator. And these are actually our care coordinators. That's our care team. That person is going to be your main point of contact. So when you call into the clinic and you opt into the care coordination services, when you call, you're going to talk to your care coordinator, someone who's familiar with you. They help coordinate your appointments, manage the follow-ups, assist with medications, making sure you get your refills in, helping navigate insurance and any paperwork. So like the disability paperwork or FMLA, that's your person that's kind of always going to be continuously following it so the ball doesn't get dropped. And then they're going to check in with you between visits. So you're not waiting months to address symptoms like keeping a list for the next appointment. They're going to check in with you monthly. And instead of trying to manage everything on your own, you have someone helping guide you through it. Sometimes if it's just to discuss, how do you think I should address this new behavior thing that came up? Any ideas? First pass. And then if it's something that I need to address, it's going to get sent to me or your provider, and we'll get you an appointment. We also have genetics. Genetics is a really important part of Huntington's disease care, and it's often hard to fully address, just during a typical neurological visit. It is a whole nother conversation that requires time. It's not, and it is just that. It is simply a conversation. So if you meet with a genetic counselor, you're not committing to anything. They're just going to give you the information, and you decide what to do with it. So it's a chance to better understand your risk, talk about family implications, and to think through your options. And then they'll also discuss things like cost and resources. We can also talk about clinical trial opportunities. So those are dedicated visits, so there's time to really focus on those nuances of the conversation. And also just so that if it's self-paid genetic counseling, so if you're not wanting to bill through insurance, it's a flat fee of $150, and it can be done anonymously. And behavioral health is a routine part of care, and that includes support for mood, anxiety, irritability, and behavioral changes, which we know can, as time goes on, those can be more problematic than the movement issues. So we work with therapists and behavioral health specialists and can help with managing medications when needed. So if during a visit I decide I've tried a few things and we're just not seeing the results that we want, or if I see that there's something that maybe would be addressed better from a non-medication perspective, something maybe I think therapy is a good idea, I would refer you to the behavioral health care manager. They're similar to your care coordinator, except they're just for the behavioral health piece. So you meet with them, discuss with them, they take the whole history, and then present your case to the psychiatrist. And the psychiatrist would make recommendations either back to the provider at Synapticure or to your PCP, or help you get a local psychiatrist if they feel that that's necessary. You also have access to therapy, both for the patient, the caregiver, the family members. It could be together, it can be separate. And then you also have access to a neuropsychologist to do additional cognitive testing and things of that nature. What this means for you. So putting it all together, It means access to expert care without long waits or lengthy travel. It means having a dedicated care coordinator to help guide you through the process, and it means support for behavioral health and genetics. It means ongoing care that adapts as your needs change, not just that one visit. And most importantly, it means you're not navigating it alone. You have a whole team of people at Synapticure to help you through the process. And that is it. Thank you. The end. And then that is, which you guys already got, the QR code for doing the intake. So hit me with questions. What you got? Anything?
Do you have any questions so far? I've got some questions.
Go for it.
All right. Well, so you mentioned that there are clinical research opportunities
Mhm.
or connections to clinical research, and I'd love to know more about how that's organized, because my understanding is that it's all remote, like all the services that you provide are remote.
Yes.
And so I'm wondering, is it that you guys are offering your own clinical trials? Are you partnering with sites and connecting patients to sites? Like, how does that work?
I envision it could be a little bit of both.
Yeah.
Yeah, we do have both. We have studies that we're actually like hosting through our company. We do have partnerships with different sites. So certain labs, things around the nation that we have in each state.
Mm-hmm.
And then we have a good partnership with other like major healthcare organizations that are running the study. And so we can easily refer patients into those studies through our team.
And then the visit would be the same. I do not have personal experience yet doing clinical trials at Synapticure, but I was very clinical trial heavy in person and got a little taste for what it was like with COVID.
Yeah.
A lot of the exam can be modified and adapted, and it's the same thing. It just doesn't mean that you have to travel, get a hotel, stay overnight, hang out in the hospital for 3 hours, 4 hours, 5 hours.
Yeah.
And it would, just depending on what that trial is and what the requirements are. Currently, we don't have anything specific I could tell you about, but it's definitely an area that we want to grow into.
Yeah, that's super interesting, because I know a lot of HD families want clinical research opportunities.
And obviously, doing a clinical research trial, you want to have a good sampling of the population, right? Not just that one group that luckily lives right next to a movement disorder
That's a great
center.
point. Yeah.
You want to see it across the board, different age groups, different stages of disease. So hopefully that will open things up.
Oh, I didn't even consider that. That could be like you guys could be like a recruitment pipeline for a lot of these sites. And that's
Yeah.
Yeah, and it's one of the nice things is because we do a couple different service lines and have great partnerships around the U.S. We have large healthcare organizations that are in multi-states,
Mm-hmm.
and so we're able to use their facilities to do any of the scans or testings that we have to do.
Mm-hmm.
But then our providers can actually be the remote PI for that study
Got
and
it.
help that facility with their patient load, with our patient load, and just help advance the studies that are going on.
Just make it a bigger team effort. Yeah.
Yeah.
So a lot of the time it's, a lot of these sites can't run the studies because they just don't have the support behind them to do it. I mean, you have to have a research coordinator, you have to have a PI that's dedicated to the study.
You have to have a project manager.
Yeah,
Yeah.
there's a lot of individuals.
You have to have the
that are
clinic
necessary.
space.
Yeah, all the regulatory components.
Mhm.
Exactly. You have to know what to do when you get audited, because those will happen.
Yep.
And so we've been doing this for many years. We have different studies. I mean, most of our studies happen in the ALS realm. So we have neuromuscular conditions that we've been studying for, but then we even have like amyloid targeting therapy studies going on. So there's a lot out there that is accessible. But to Jennifer's point, I mean, it's getting to the right individual to even like help you navigate that. So you're not just going to that clinicaltrials.gov site and saying, oh, look, this says Huntington's, that's what I want.
Right.
And then finding out you don't even qualify.
Right. Kind of like
And
what
so-
we were talking about downstairs.
Yeah.
Absolutely. Yeah.
Do you find that most of your patients currently use your providers primarily as their specialists, or is it kind of a
It's a
blend?
mix.
Yeah.
It's a mix. I mean, I think there is that celebrity feel of being able to say, I go to such and such center of excellence. And we are more than happy to work in conjunction academics, like I said earlier, you know, it's hard from both sides. It's hard to get the time. You know, the clinicians are extremely busy, the travel for the patients, they can only see so many patients a day. So I think it's a kind of symbiotic relationship for us all. You go and see your movement disorder specialist at a center of excellence or whatnot, that one visit, the full whammy, and then when things come up, you know, they call us in between. I'm very, very much a, like, everybody needs to know their role. You know, you do not want one clinician telling you to do one thing and one clinician telling you to do something else, or I don't know what medication was changed over here and something I do can be wrong. So we try very, very hard to make sure there is an open sharing of information. I can, you know, the clinician can call me on the phone. We can have actual conversations about the patient and make sure that we are given the best care, not just like filling this little hole for this one problem. Like, we are all actively taking care of the patient. And sometimes we just divide it. Like, you're going to do the movement stuff, I'll handle the behavioral stuff. You know, so it's really up to that other team what everybody's comfortable with doing. So far, it's worked very well because, you know, it takes a load off of their plate to some degree. The patient's getting better care. I think it's a great system, especially for those that have to travel.
The follow-up between appointments, a lot of our providers and like external facing providers, so any of these specialists that are already seeing patients, they appreciate the fact that we're so communicative with them. I mean, our notes flow right back into their system. They're able to view them anytime. They know exactly what happened at our appointments. And if we make a recommendation, I mean, there's a reason for it and we have justification, but we're not going to just up and change somebody's full medication plan and do it on a whim. We work hand in hand, which is very, very beneficial.
I always try to find out. It somehow ends up being like pockets of patients. So you'll see patients from the same provider, but like how they want to manage things. Some places it's like, go ahead and make the changes. Other places it's just I send recommendations and then they decide what they want to do. So I think it's been a very good open communication. I've been in other places that maybe it wasn't so great, but I can see their notes. We make sure they get ours. And I've found it very frequently, a provider will just, I can actually talk to them on the phone really quick. I'll be like, hey, I saw so-and-so, want to run this by you. Okay, sounds good. And that is a lot in healthcare.
It's great to get buy-in from both parties instead of it being two different.
You feel more like a
plans.
team. Yeah, exactly.
More wraparound care for that patient.
Did any questions come up for you as we were discussing?
I know.
More.
Yeah, go for it. Yeah.
I'd be curious to know from your perspective as a provider and also having worked in person as well, what do you feel like are the challenges of doing remote visits, if there are any? And if there are any, I'd love to know how you feel your team and Synapticure overcomes those challenges.
This is honestly, there have been less challenges working for Synapticure than when I worked in clinic. That's part of the reason why I decided to make a change and see this as something more forward thinking and something that the patient population is definitely going to grow into over the years. It's just better access, and I'm working with a group of people that I know really care about the patients. I mean, with it being started from a patient and a caregiver, that idea is still there. It's still fresh. The meaning, and when you're surrounded by that type of a team, it just makes you feel like even better as a provider, and that you're doing the patients a better service. Honestly, because I have my care coordinators, I think it's a better system. Because I know my care coordinators are going to reach out and help find the resources. And it's easy for me to connect with the care coordinator. While I'm seeing patients, I can get a message from the care coordinator in that moment. If a patient's calling and having some sort of issue and they need my attention, I can at least see it, note it, like I'll get back to you in 10 minutes, whatever. So the things happen a lot faster for the patient. So that's why I think it actually works better sometimes than being in clinic. And one of the primary reasons that I left in-person clinic was just the way the care model had changed. Where I was, instead of having a dedicated nurse, it was a group of people. And when I worked in person, there were some patients I had been seeing them for 13 years. I knew these people, I knew their families, I'd gone through changes in their life. When you call in and you can talk to somebody that you know, I also know that that person's going to know what questions to ask, because they know that your daughter lives 3 states away, or they know that your husband travels on this date and this date and this date. It's that piece that makes it a better care model in general. You're not just treating a patient, you're treating the person.
Yeah.
And some of that is just the social aspects. You have to know your patient.
Yeah.
And I know that my care coordinator does. And that's the part that makes it easier for me.
For sure.
I don't have to go back and say, okay, ask this, this, and this, and this. Well, remember, yada, yada, yada. I can trust that they know the patient as well as I do.
Super interesting model.
Mm-hmm.
Yeah, it started on the mission of just ALS. I mean, to Jennifer's point, we were started from a caregiver. I mean, Sandra and Brian were so big in the nonprofit realm before this when he was recently diagnosed with ALS. And they were part of support groups, and they got to hear stories, and then they got to share their experience. And then they came to the point of saying, hey, you know what? We're not getting what we need, and we're not alone. We're not the only people out there struggling right now.
Yeah.
So we need to develop something that's going to help people. And then they came up with Synapticure.
I think the hardest part is finding the resources.
Yeah.
I mean, I think that's what everyone kind of comes to the conclusion. And a lot of it is word of mouth. I think being in the support groups is super important. Just, oh, my husband is doing XYZ. Oh, John did that, and this is what I did. Okay, I'll go home. I'll try that. Let's see if that approach works. There's so much that you learn from each other, and so much that I learn from patients.
Yeah.
And I think that's one thing that I've enjoyed actually being at Synapticure. I'm seeing patients all over the US. I'm getting a lot of different perspectives on how to go about certain things. I mean, I have access to more information just because my patients are in different places. And then I can share that with subsequent patients.
Yeah, I feel like with COVID, everybody had to get used to remote visits.
I think COVID was good in that respect.
Yes, it did nudge us in that
People
direction.
watch a lot of this.
And it helped people feel comfortable with the idea of seeing a doctor via a screen or
Yeah.
a healthcare provider through a screen.
Yeah.
And I can imagine some patients might still feel like what you were saying before, like, is this real? Like,
Yeah.
am I really getting, the care that I need? But it sounds like you provide so many other services and opportunities to show a patient, like, hey, we do really know you and we remember you from
Yeah.
your last
And
visit.
I'm lucky in the sense of currently at Synapticure, I get more time with my patients than a lot of providers do in private practice or big clinics where there's just a lot going on. I don't have so much of that. I can take the time to discuss more than just, oh, just start your medicine, how'd it go? Good, next patient. So I think some of it is a little bit of like an age barrier, and I'm right on that border because I'm older than the internet,
Me too.
Yeah, so some of it is like, can this be real? Now the younger populations, they do everything. Like they have total buy-in
Right.
for telehealth. So there's a little bit of a barrier still for that. And I think there's also that question, like, are these people quacks? Like, are they real doctors? Why are they doing telehealth instead of being at I won't name any institution, an academic institution?
Yeah.
The reason why is because I want to have more control over what happens in my visit with my patients and make sure that they're getting what they need.
Yeah.
That's why it was a choice. It's not like I had to do it
Right.
because I got ousted out of the group or something. I made the choice because I saw how much my patients were struggling as they progressed in the disease. And people would just disappear. I've seen people for years, they would advance and they would just disappear. And it's like, well, are they getting care? They can't get into the visits. So where are they? So that's
Do
how
you
I
try
learned
to
about it.
find out what's going on with those patients that
well, I don't have that situation now, but a lot of times we would try to reach out and follow up and to see where they were. A lot, it would be sometimes going to the hospice or sometimes just having to do the best with what they had locally, so to speak. They may just start kind of going back to their PCP for just kind of general management, but sometimes things happen that are just kind of above their exposure level. It's different when you see one Huntington's patient a year or one a lifetime versus seeing, 2, 3, 4, whatever a week. It's just going to be totally different. And honestly, a lot of places, they don't even have general neurologists, much less a specialist.
Right.
We were talking about that. We saw a giant exodus out of West Virginia last year. They don't even have neurologists up there anymore. They literally have nobody. And I think that was when I made the decision. I saw several of my patients just, my general neurologist left. It's 4 hours to get down here. I have my PCP, but that changes every year because they don't stay for long. And I was just like, geez, like how unfair is that? Everybody deserves good care.
Same thing happened in New Mexico. They have a very, very small pool of general neurologists, but they're not anywhere cognitive, movement, or neuromuscular focused at all.
Okay, yeah.
And so they don't even know a lot of those conditions. And so it's harder for them to treat the patients. And so a service like us is great. And so we've uncovered like big cities that have no access that you wouldn't even think of. I mean,
Wow.
one of our larger markets is Seattle, for example, and
wow.
we do a lot in the Pacific Northwest. We do a lot in the kind of Midwest to West regions. Then we do a lot in the South, Northeast. I mean, big states like New York, New Jersey, Pennsylvania. I mean, those are all big markets that we're in, and to the point of like not having access to neurologists, let alone a specialist within the neurology field. It's just that lack of support that you lose. And then like one of the things that happens with in person is you see the neurologist for 15, 20 minutes maybe for that appointment. They then want you to follow up with their care manager or their support system. And so eventually you'll meet their social worker, eventually you'll meet their care manager, but it may be a couple months because they're also backlogged. Then you might get lost in that system. And so that one recommendation that happened 9 months ago might not even be valid anymore because your condition progressed.
Or even just now they show up for the appointment and the order is no longer valid. I can't tell how many times that happened where, a lot of times the patient, the caregivers, the spouse is still working. They may still have kids in the home. They're busy. She forgot about the speech therapy referral until the next visit. And then, okay, well, I've got to send a new one in where if you had a person, they're going to like at least follow up with you like, hey, I sent in your speech therapy referral. They tell me you have an appointment on such and such date, or you can reach out to them whenever it, dawns on you. Oh my gosh, I forgot. You reach out to your care coordinator like, hey, this needs to be done. I can put the order in. You go on about your business.
There was that one woman downstairs who asked the question of like, there were so many resources and so many places I could go to get clinical research, advice or lists of
Yeah.
what's out there. Like, what's my one-stop shop? And it
Yeah.
sounds like the care coordinator very much is a one-stop
Yeah.
shop for next steps.
Yeah, it's similar to like, I think nowadays medicine's very siloed. You have your specialists for everything, and your PCP is kind of the person just making sure everything is like T's are crossed and I's are dotted, and making sure that it happens. They're kind of like the ringmaster. Yeah.
With my mother, her whole case kind of fell into a crack because she was going through testing for probably a year or two.
Mm-hmm.
They were testing her for Parkinson's and all this stuff. And then they finally referred her to a neurologist who did the whole Huntington's testing and cognitive testing and all that. Well, when she was supposed to go back and get the results of that, she canceled the appointment because she was going to have surgery. She was going to have a knee replacement.
Yeah.
So I didn't know that she had an appointment, and I didn't know she canceled it.
We just had multiple conversations about this. Huntington's disease
So-
patients, they just like get lost in the system so frequently for
Even
that
though
reason.
she probably could have gone to that doctor just fine, it wouldn't
Yeah.
have interfered with the knee replacement, but she's like, I got this going on.
Yeah.
So I take her to her primary care doctor, and she says, oh, did you ever get the results of your test? And Mom's like, I don't think so.
Oh,
And
she
so
didn't even.
that doctor said maybe I have access to the test. So she printed it out and handed it to us, and she said, I'm so sorry. And I was
Yeah.
going, what's going on?
Yeah, you're like, what does this even mean?
Nobody
Yep.
in my family.
I was going to say, you clearly
Nobody
have to
knows
be a no history.
anything about Huntington's
Yeah.
disease. Nobody.
And
It's
that's why it
never
took
come up.
so long for her to get to a
So
diagnosis.
this was in May, and I called the neurologist and I said, we need to come in and see you. And as soon as they said they could get me in get her in was September.
And here you are with this
So I'm
like
waiting
time bomb in
for
your
all that
hand.
time
Yep.
to get in. So it's like
Yeah.
you're talking about having somebody.
Yeah,
Yeah,
and
that
in that
can-
case, I mean, obviously that we are very, very lucky to have genetic counselors too. You know, that would be have a conversation up front before testing, and that's not something that we always have access to, even in big institutions. Yeah, that unfortunately, I have seen that happen in real life, where the patient's gotten a hold of the records even before the provider, and that conversation didn't happen until much later, and that's
the
just messy.
neurologist was furious. She said,
Yeah.
neither one of you should have received that kind of information.
Yeah, that's a
From
irregardless.
somebody
Yeah.
just handing you a report, and I'm looking at it, I'm like, what are CAG repeats?
Yeah.
What are alleles? What does this mean?
Mhm.
Right.
It says, diagnosis positive for Huntington's disease, and
Yeah, and you're like, how is this even possible? Where is this coming from? You've got a
her
million
parents,
questions.
Her mother died in her late 60s.
Mhm.
Her father died in his early 70s. My mother started having symptoms in her 70s.
Well,
So I figured both of her parents probably died before any of their symptoms were really bad enough, or
Possibly.
maybe even started.
yeah, possibly. Or, you know, someone has to be that N of one. Someone has to be the one that has that extra tip over in allele. It has to start somewhere. She may have been the first, but a lot of providers, even, you know,
Can
primary
that
care,
happen, that
yeah,
neither one of her parents had it?
it could
and
be a
she-
possibility, because you have to, until you hit 40 repeats, then you're, you know, you have the disease. But when you're in that 35 to 40, say that goes for several generations, 35, 35, 36, 36, 36, 37, 37, until it tips over.
Wow.
Yeah, and that's why sometimes it takes longer to get to a diagnosis, because people don't even put it on the differential. Because they're like, oh, you have no family history, moving on. That's where it's important to have a movement disorder specialist.
Well, hers was 40.
Yep. She may have just been the
She was
first
right
one that,
borderline.
Yep.
Just tipped right over.
so you
I
always,
tell people, I say, yeah, my mother won the lottery, but not the good one.
absolutely.
Because it's almost like the same odds.
Yeah.
Mhm.
Winning the lottery
Yep.
is to winning HD.
Yes.
To your point about being given results outside of the context of having proper counseling, you know, when someone hears that a genetic testing result is positive,
Mm-hmm.
the typical person thinks positive is a good thing.
Yeah.
Not necessarily positive in terms of what it means from the standpoint of the genes, right?
Yep.
And so
Oh, yeah.
even that needs to be parsed out
And
and
that's what I say.
explained.
Anytime results come in positive or negative, I'm like, we're going to have a discussion about it, so that we are clear, questions are answered, irregardless, positive, negative, so that you know. Yeah, that, unfortunately,
Yeah, I
that
did
happens.
anonymous testing.
Mm-hmm.
It's all virtual.
Yeah.
I did the test at home and everything.
Well, luckily, at least there are more options for that
Yeah.
now, even than there were.
And when I even
5 years
started
ago.
looking at, I live in Western North Carolina,
Mhm.
so where places to
Yeah.
go to even get genetic testing, and there weren't very many places. to
Yeah.
go. So
And
I was glad.
yeah, I
that I could
appreciate
do
the
it.
fact that ours is anonymous.
Yeah, I did it through HD.
I was going to say HD Reach is about the only avenue I can think of in that area.
And it was weird because I had gone through all the counseling,
Mm-hmm.
and they finally said that they'd let me do the test. And so I did the test, and it took about 4 weeks or so for the test
Yeah.
to come back, and then we had another virtual appointment, but she said, you can't be by yourself, you have to have a family member with you
Mm-hmm.
for when you get the results. So my husband, he left like an hour early from work to make sure he could be home. It was a horrible accident.
Oh, no.
So I told the counselor, I said, my husband, he actually started out there. There's no like going around the block.
Yeah.
Like you have to go around a mountain or
Yeah, you have to
something.
go around
So he
a whole
went
nother city.
into another town and came down. It took him like an hour extra to get home from work. And so I told him, I said, is there any way we can, because I'm like, I got to.
You're like, I gotta know.
I'm ready to
Yep.
find this out. And I said, there was a terrible accident, and they've got the road blocked, and he can't get here in time. Can we like do this
Later.
reschedule? I mean, we already had it scheduled like 4 o'clock. I said, can we reschedule for like 5? And she said, well, I don't think so. She says, I'm just going to go ahead and tell you your test came back negative.
No.
She said, I can't bear the fact that you would sit there and suffer.
Yes, waiting and wanting to know. Thank goodness.
I appreciate that.
It's like, of all times, this never happens.
Well,
There's hardly even any cars on the road.
I know, right?
Yeah, I mean, that's life. One of the things about genetic counseling that I've learned, I come from a different realm in healthcare, so neurology is still newer to me. But like I didn't realize how expensive it can be, and so a lot of people put off getting genetic testing done because it's usually $400 to $500.
I would say even through HD Reach, I mean, it's
I paid $1,200.
yeah. I would say
Yeah.
I knew it was over
Which
$7.
it was worth every penny.
Yeah,
So
yeah.
somebody told me that last week when I went to a different conference, and I'm like, what do you mean that you went down to I don't want to say the name, but somewhere in Arizona, and you were charged $1,400 to do your test. And I'm like, our genetic counseling team, we set our rate at 150 as a self-pay for a reason. We want it to be accessible.
Yeah.
And yeah, I mean, the test may be an additional fee, but at least you have access to that. You will be able to talk to somebody before just dishing out all the money and
Yeah.
hoping you're applying for the right tests. So I didn't even know that realm can be so different.
Well, and we are lucky because in that sense, when I work for in-person clinic, I mean, let's be real, medicine is a business. Things cost money. They can't pay all this money out and not, get reimbursed in some way, or we wouldn't have hospitals. But some of the genetic testing we would order, I mean, we would have to figure out like exactly what we wanted to try to whittle the cost down. I mean, some of it was as much as a car, a nice car. And it's like, how in the world, like there's got to be a better way to do this. But yeah.
There are so many factors, so many personal factors that already go into the choice of pursuing genetic testing, and then adding in the complication of affordability makes it so tough too.
But then there's the flip side. Then there's like, as a provider, my thing that I'm like, oh, geez, these places where you can just go order whatever you want. And I'm like, oh my goodness, here you are. You've had to have 4 visits to get the test that you paid for, and you've had counseling. And then there are people out there just ordering willy-nilly their like entire genome sequenced, and then they get the results and they don't know what to do with it. That is just like terrifies me.
Well, and it's not anonymous, so they get entered into the database. So a lot of people don't want their information out there, right? I mean, we know to get on like long-term insurance for the future, there's a lot of disqualifiers. And it can be as simple as getting a test done and just showing that you're slightly at risk for something, slightly. And that could just be the decision maker that says, nope, you don't qualify anymore.
But, that's somewhere in the fine print of all the stuff they didn't read online, right? They're just clicking, order it up. Yeah.
Which is why there's
Yes.
a plan set up in place before
Exactly.
you pursue testing so that,
Yes.
that doesn't get impacted down the road once you get your results.
There,
Oh, yeah.
yeah. I mean, until I worked in Huntington's disease, I did not. I was naive to how much goes into it, how much forward thinking you have to put into it
Yeah.
for the potential implications. So, what do you do? I heard her say something about clinical. Do you work in clinical trials?
I do work in clinical trials,
Okay.
but I'm also a genetic counselor too.
I was getting
I love this
some
conversation.
feels. Yeah. No, I mean, I think my social workers and genetic counselors are like medical unicorns.
Oh.
Honestly, because I'm like, oh, thank you, I have that resource. Thank you so much. Because there's so much information out there that, as a provider, I can't read everything. I can't be the expert on everything, and it's so nice to have the help. Yeah, it's good for the patients.
One more quick question
Mhm.
for you guys about Synapticure, because your story kind of prompted me in thinking this. I know you send a Zoom link so that patients can log in,
Mhm.
but is it easy to incorporate other family members and
Oh,
caregivers who
absolutely.
live
Yep.
with?
Oh yeah,
Because
I
that's
have.
something that I feel like wasn't always super widely offered
Uh-huh.
during COVID,
Mhm.
but it's so helpful when you.
I think we're still trying to figure out like all the HIPAA firewalls and things like that with Zoom. But also, I mean, I shouldn't even say it because I'll speak something up. But I have had zero problems with actually connecting with my patient. Where when I did telehealth in my actual in-person clinic, I offered some telehealth. It was painful for me and for the patient. The link wouldn't work. The patient couldn't get logged in. There was no support. We have an excellent support team. Like all that stuff is pretty much figured out before the visit. And if it happens in the visit, I can pretty much immediately get help for the patient to get it going.
That's great.
And I think that's part of the reason people are like kind of leery of it, but they don't know that part. Like we will get it going. And if it doesn't work, I will make sure that I see you as soon as possible. We'll get it figured out.
Yeah, I mean, from COVID, we were so used to just using Zoom or Skype or one of these other type of video platforms, and people are like, wait, is that even secure? And then, let alone now that's being used for telehealth. But within Synapticure, we've actually like made sure our Zoom platform is the most secure. We put all of the right firewalls in place to make sure that everything is as secure as possible. But to Jennifer's point, I mean, it's real simple, right? We give a link that's there. There's nothing to download. You don't have to like jump through all these hoops and like give the last word your social and all this stuff. Of course,
Yeah.
we can verify your HIPAA on the appointment, but you don't have to jump through all these annoyances.
And
to
it's
get into
faster because everybody's on the computer. So in-person clinic, it would take 30 minutes for my patient to get roomed, for them to get vitals, for them to, go through their medication list. I'm like, well, 3/4 of my appointment time is over now. I don't know what magic happens before I log in, but my patient is like ready to go, medications in, everything's working literally at the appointment time. It's super quick, super easy. And to your point, I have a lot of patients who maybe the patient's in North Carolina, but the daughter's in Pennsylvania and the son's in Florida. We can all log on and have a family conversation, and it's not a big deal.
That's great.
That way, and I like that because oftentimes, whatever condition my patient has, I need another support person. And obviously, I've learned the social aspect. I'm going to get a different story from the daughter than I am the husband or I am the son. Somebody is going to give me like that nugget of information that I've been looking for, because sometimes the patient's not going to tell you everything, like that ever happens, or someone's going to downplay something. So I like to involve at least one or two family members at some point.
Well, with HD with my mother, she would tell me how bad her neck was hurting. I'd say, "Are you in any pain?" She said, "Oh no, I'm good." I said, "Mom, you are taking medicine. You can't sleep. You can't turn your head.
Oh, yeah.
It's the
And she doesn't realize that she's saying something wrong.
Well,
So
again, I mean, I hate to
the
say it's
doctor's really not
generational,
getting the full picture
but
of
sometimes,
what's really going on.
people just don't want to, they see it as like I'm complaining and they're not comfortable with that. Like, well, I'm not going to complain. No, I'm the person, I need you to complain to me. Let me hear it, and then I'll tell you what is relevant, what we can work on, or maybe what you need to do for these other things. Yeah, my favorite is like, if you had any falls, nope. Wife's like, you fell this morning. It took me 45 minutes to get you up out of the floor. What do you? Oh, well, that wasn't a big fall. I didn't break anything. I'm like, but I need to know those things. So yeah, I like to have some extra sources of information.
Great.
Yeah, I think of one story. I have a good friend of mine, and her mom was just in the hospital, had surgery, her knee surgery. And I love the patients that come off of anesthesia and how they feel. And then the next day, to that point, they don't want to be a burden.
Mm-hmm.
But then, it's hard to get ahead of pain. So if you're already ahead of the pain, stay ahead of the pain. And so I came from working at the hospital in orthopedic surgery, and my biggest thing was, how much pain do you have right now? What is your pain on a scale of 1 to 10? And they're like, oh, it's a 3. And I'm like, okay, I'm going to give you something, because in 30 minutes, that's going to be 10.
Yeah.
And you're not going to tell me it's a 10. I'm just going to hear you whimpering in here, and I'm going to have to bring some ice, and then we're going to have to bring a team and some extra pillows. And yeah, no, we're going to use some stuff now. So, yeah.
Well, I used to be like that. I'm like, well, I can tough it out. And then one day they said, it's harder for you if you get in severe pain.
Mm-hmm.
It's harder for us to get you out of pain than if you just stay
Ahead of it.
Exactly.
Don't let it
on a
catch up.
plateau.
And that's with a lot of things. That's why I'm like, tell me now what's going on, and we can have a conversation and decide like how serious it is. In reality, that's what I'm here for. We'll have a conversation about it, because what you may think is nothing may mean something different to me, or something that you think is really, really bad. I might be able to alleviate those fears and tell you it's not. And I think also, because we have more time, I get to talk more about like the mood and the behavioral aspects. And that's the part that oftentimes in in-person clinics, there's just not always enough time. It takes half the visit for the patient to warm up to even talk about it, or it just, or you have a whole full visit and you go through a bunch of things. I have the ability to say, I know there were these other 2 things we didn't hit on today. What are you doing on Friday? You want to have another visit? We'll make sure we catch those 2. Or next week, whatever. We'll make sure we hit it all, and we'll find a time that works. As opposed to, well, table that until your appointment 9 months from now,
Yeah, we'll catch that at the next visit.
Or their in-person person does the big stuff, and whatever was left over, I can see them that next week, and we'll go over that stuff. So
Sounds really good.
tell everybody.
And plus, as soon as the appointment's over, where are you? You're at home.
Right?
Yeah,
You don't have to
exactly.
fight traffic and drive around the whole mountain.
I know.
To get an accident.
Well, and that's one of my I think it's funny, my patients are like, well, I didn't do my hair, my makeup. I'm like, honey, you do not need to look good for this appointment. I don't care if you're in your pajamas in your bed, as long as I can see you and you can move around so we can do an exam. I don't care. You don't have to, I know how long it takes, you to get ready to do, like, you don't have to do those things. No judgment zone.
You don't have to wear your Sunday's best to an
Yeah.
appointment anymore.
Yeah.
It's great.
It's just a different level of comfort for a lot of people once they get over the fact that it's virtual.
For sure. Yeah.
You're
Yeah,
welcome.
absolutely.